Shababali, a portfolio manager at Grand Challenges Canada, and I'm part of the Being Initiative, which is our global mental health program. I'll be running the session today with support from my colleague Erica and the rest of the Grand Challenges team. So please note that this session is being recorded and it will be posted on the Being website. We have a lot of material to cover, so let's get started. The session agenda is as follows. The formal presentation starts off with a brief overview of the Being Initiative. We'll then move into the crux of the presentation, which is our recently released request for proposals. This RFP is different than others that GCC has released in the past, so we'll be covering material that you're likely to be interested in learning more about. We'll provide an overview of the RFP, followed by information related to the application and review process. I'll cover eligibility and rolling applications at this point. We'll then move into the question and answer period. Please note that this session is meant to be used in conjunction with the request for proposals and the frequently asked questions document found on the Being website. Now, the session is not a standalone source of information as it only provides an overview of the material in these documents. Please refer to the RFP and the FAQ for complete information about the application process, and the review process. Now, before we jump into things, I'd like to highlight the session format. As I mentioned, we'll start with the formal presentation and then we'll move into the question and answer period. As we're moving through the material during the presentation, you may have questions which we encourage you to share via the chat function. My wonderful colleagues at GCC will be monitoring the chat and will respond to straightforward questions directly in the chat. As questions are coming in, commonly asked questions and more complex questions will be reserved for the question and answer period. So please don't be discouraged if your question isn't answered immediately. For those who are unable to stay for the entire presentation, or for those who are listening to the recording, please be aware that the Being RFP frequently asked questions will be updated on a regular basis. So please be sure to check this document regularly. If you're listening to the recording and are unable to find answers to your questions in the RFP, the frequently asked questions document, and this presentation, please submit questions via the provided email address, info@being-initiative.org. I'll now turn things over to my colleague Erica to provide an overview of the Being Initiative.
Thank you, Sureisha. So as Sureisha just mentioned, we are going to begin with a brief overview of the Being Initiative. Next slide, please. So Being is a global mental health initiative that envisions a world where young people feel well and thrive. Being's mission is to work in partnership with young people to improve their mental health and well-being. Being funds and supports research, innovation, advocacy, and ecosystem building with a focus on prevention and promotion in 12 priority countries. Being was launched in response to the ongoing mental health challenges faced by young people in low and middle income countries. Next slide, please. Grand Challenges Canada, or GCC, is the host of the Being Initiative, and we manage the operations and implementation of the initiative. As an organization, GCC funds and supports innovators in low and middle income countries in Canada to seed and transition to scale their bold ideas with big impact. GCC's areas of impact include global health innovation, humanitarian grand challenges, and the Indigenous Innovation Initiative. To date, GCC has funded over 1,400 innovations in 96 countries, which are expected to save up to 1.78 million lives and improve up to 64 million lives by 2030. GCC has also supported one of the largest portfolios of global mental health innovations in the world and has invested roughly 63 million Canadian dollars to support 151 projects across 47 low and middle income countries. Next slide, please. Being is the product of a collaborative partnership between Grand Challenges Canada, Fondation Botner, the Science for Africa Foundation, and United for Global Mental Health, and works alongside support from United Kingdom's Department of Health and Social Care and Global Affairs Canada. Origin is Being's learning and support platform and provides technical support to funded projects. Next slide. Mental health challenges disproportionately affect the most marginalized members of society, those living in poverty, women and girls, refugees, young people, and those most at risk of violence and discrimination. While populations in low and middle income countries bear 82% of the global burden of mental ill health, up to 90% of their mental health needs are not met due to a lack of resources and infrastructure. The global mental health burden is magnified for youth living in low resource settings, with 75% of mental health challenges starting before the age of 24. Poor mental health in youth negatively impacts the development of social connections, cultural belonging, and emotional well-being. The current focus of mental health initiatives does not meet young people's diverse needs and demands. There is a strong focus on individual factors which does not adequately address systemic, economic, social, and cultural drivers of mental well-being among youth. There is an urgent need for youth-informed mental health approaches that shift from an individual and medicalized approach to one that creates a supportive environment that caters to the needs of young people. Next slide. Being's approach is centered around young people and is deeply rooted in rights-based, participatory, inclusive, and collaborative principles with the overall goal of supporting young people's mental health and well-being through a combination of research, ecosystem engagement, and innovation. Being integrates a relational approach to well-being, which goes beyond individual psychology and behavior and looks to the early drivers of mental health challenges, which includes a strong emphasis on connections, environment, and socioeconomic systems in which young people live. Being works within three main pillars: learn, invest, and mobilize. The learning pillar focuses on the role of learning and research as a driver for systems change. The research workstreams seek to understand the mental health ecosystem, drivers of mental health, impacts of emerging stressors, and barriers to scaling mental health innovations. Being's funding priorities were guided by locally driven country analyses and stakeholder consultations with youth, policymakers, local organizations, and mental health experts. Through the investment pillar, Being funds and supports youth-led organizations to address the drivers of young people's mental well-being. Early stage innovations will be selected and supported as they are tested and proven, while later stage innovations will be supported as they continue their journey to scale and impact. Finally, our Mobilize pillar focuses on stakeholder identification and engagement with the goal of uniting donors, funders, investors, governments, scaling partners, and local intermediaries to advocate for people's well-being. We also fund ecosystem building grants to help address systemic barriers to implementation and encourage the integration of mental health services into health systems and policies. Next slide.
Great, thanks, Erica. Let's now jump into an overview of the request for proposals. The overall goal of the RFP is to fund bold prevention and promotion ideas that address the early drivers of mental health and well-being for the most underserved 10 to 24-year-olds. We're specifically looking for innovative and context-specific solutions that address the upstream drivers related to youth mental health, specifically for young people ages 10 to 24. Now, this is specifically related to our proof of concept and transition to scale funding that I'll be expanding upon later in the presentation. We're also looking for ecosystem level efforts that address systemic barriers and integrate mental health prevention and promotion on a broad scale. This is related to our ecosystem catalyst funding opportunity that I'll be expanding on as well. And we've identified 12 priority countries that represent Latin America, Africa, Southeast Asia, South Asia, and Eastern Europe, and are the focus of this RFP. Therefore, only projects that are being implemented in one or more of the 12 priority countries are eligible to apply for this RFP. There were a few factors that were considered when choosing these priority countries. As Erica stated earlier, Being is a collaborative initiative, so the country selection criteria was aligned to the priorities across partners. For instance, some of the criteria included government preparedness for sustainable implementation and scaling of proven solutions, rapidly growing urban centers where a large proportion of young people reside, as well as young people's needs regarding mental health and well-being. These are just a few factors that assisted with choosing the priority countries. Please note, at this time, we are not adding other countries to this RFP. Now, each priority country has specific thematic priorities or areas of focus that have been identified through locally led research. This process involved desk research, engaging with diverse stakeholders, including youth and those with lived experiences of mental health problems, and consensus building to help identify the most important drivers influencing youth mental health. Once important drivers were identified, the Being team developed a prioritization process. Prioritized drivers were then shared with organizations that conducted the research to ensure the selected areas aligned with their experience and findings. Other local experts were also consulted about the prioritization process and areas of focus, including our Being advisory groups as well as the Being Council. Now, these specific areas of focus and target populations are specific to each country and specific to each funding opportunity. For each country, proof of concept and transition to scale areas of focus and target populations are the same. However, ecosystem catalyst areas of focus are different. Please note that the proposals should align with these specific areas of focus based on the country of implementation and the funding opportunity. Please refer to Appendix A in the RFP for more details. There are 3 available funding opportunities through this RFP. We have proof of concept, transition to scale, and ecosystem catalysts. Proof of concept funding is available for those innovations that are in their early stages. The goal of these innovations is to strengthen the pipeline of tested mental health innovations targeted at young people that are developed and managed by young people themselves. Transition to scale is available for tested innovations. The goal is to assist innovators to build out the evidence or attract additional capital and smart partnerships from local governments, multilateral and private investors so that innovations can be scaled and sustained over time. And finally, ecosystem catalyst grants support ecosystem level solutions that address the broader systemic barriers and support the broader integration of mental health and well-being into adjacent areas to build local demand. The goal is to strengthen national ecosystems for youth mental health. The rationale for the 3 funding opportunities is to encourage project teams to coordinate, leverage findings and expertise, and work together towards a common goal, which is to strengthen landscapes for young people's mental health and well-being in the 12 priority countries. Now, the proof of concept funding opportunity is for innovations that are in their early stages, as I mentioned. Funding of up to 250,000 Canadian is available over 15, 18, or 24 months. Primary target users are underserved 10 to 24-year-olds in at least one of the 12 priority countries. However, applicants may choose to focus on a specific age group within the range of 10 to 24-year-olds. Projects should take into consideration the wide developmental range between 10 and 24 years of age and consider which types of interventions are best aligned with the developmental needs of the specific age group. As well, innovation should target the most relevant age group for the country-specific area of focus. Please note that some country areas of focus also include secondary target populations, such as caregivers and teachers, who must also be considered and included in proposed innovations. In terms of geographic scope, innovations must be implemented and tested in at least one of the 12 priority countries. As well, innovations must align with country-specific areas of focus outlined in Appendix A of the RFP. Now, the transition to scale funding opportunity is for promising innovations that have achieved proof of concept or demonstrated initial positive results of innovation and have significant potential to achieve sustainable impact at scale or as it reaches more people. Funding between 300,000 and 1.5 million Canadian is available over 12 to 48 months. Please note that transition to scale funding is provided based on the stage of development of the innovation. For example, innovations may be generating evidence of impact needed for scaling, building organizational capacity needed to scale, or strengthening strategic partnerships for a sustainable end game. Thus, applications must identify the purpose of their TTS project and the amount of funding requested in their application. Transition to Scale's primary target users, geographic scope, and country priorities are all the same as proof of concept, which means that the primary target users are underserved 10 to 24-year-olds in at least one of 12 priority countries. However, of course, as I mentioned earlier, applicants may choose to focus on a specific age group within that age range. I also mentioned that some country areas of focus must also include secondary target populations such as caregivers and teachers, who must also be considered and included in proposed innovations. The geographic scope includes implementing in one of 12 of priority countries. And of course, innovations must align with the country-specific areas of focus outlined in Appendix A of the RFP. Both proof of concept and transition to scale have several similar criteria, so we'll go through the common elements now. Both proof of concept and transition to scale have a common focus, which are prevention and promotion aspects of youth mental health. This means that we're looking for innovative and context-specific solutions that address upstream drivers, also known as the social determinants related to youth mental health. With this focus on prevention and promotion, we're shifting from a typically reactive approach to a proactive approach. For instance, many interventions are typically individually focused, medicalized approaches, and thus focus downstream. However, our RFP focuses on interventions that aim to address the social, cultural, and economic drivers that impact young people's mental health and well-being, which are upstream determinants of youth mental health. In addition, we're looking for innovations that are appropriate for the age group that is being targeted, highlight and promote the voices of young people, provide mental health supports or programs through a variety of youth-friendly mechanisms, including health and non-health avenues, such as schools and communities. And finally, we're looking for innovations that can be integrated into existing systems, such as the educational or social care system. In addition to country-specific areas of focus and the criteria mentioned on the previous slide, proof of concept and transition to scale innovations should also seek to integrate one or more of the following cross-cutting themes. Tackle the outcomes of damaging gender norms and consider the mental health needs of people with diverse sexual and gender identities. Address stigma and discrimination related to mental illness with a specific focus on stigma experienced by young people. Understand the impact of power differentials on young people's mental health and consider the limited agency and autonomy faced by young people. Creatively leverage technology that is highly used and trusted by young people while considering rigorous monitoring and evaluation and tracking of priority outcomes. And finally, consider the distinct mental health needs arising from intersecting experiences of discrimination and marginalization across various identities, such as socioeconomic status and religion, for example. Proof of concept and transition to scale prevention and promotion innovations may achieve impacts through many pathways. However, successful applications must clearly define at least one relevant priority health outcome that the innovation will achieve. Some priority health outcomes may be directly related to youth mental health and well-being, such as improved well-being, life satisfaction, emotional regulation, connectedness, or social capital. Other priority health outcomes may be related to knowledge, such as improved health literacy, while others may be related to attitudes, such as reduced stigmatizing attitudes towards people with mental health issues. Please see Appendix B for additional information on priority health outcomes. Successful proof of concept innovations are defined as those that provide evidence using appropriate methodology, ideally from a controlled or limited setting, that the innovation improves one or more proof of concept priority health outcome for the primary target population, who are 10 to 24-year-olds. They're also defined as having feasible next steps or plans for sustaining the innovations in a targeted region and or scaling across a larger region, and or they provide evidence that there is demand for the innovation from key actors in the geographic area for ongoing implementation and scale. With this in mind, proof of concept applications should develop project plans that aim to demonstrate measurable change, develop strategies for developing sustainability and scaling plans, and engaging key stakeholders. Successful transition to scale innovations are defined as those that provide evidence from a controlled or limited setting that the innovation improves one or more TTS priority health outcomes for the primary target population, that they provide evidence the innovation can be feasibly implemented, sustained, and financially supported at scale in the target settings and or regions, and or demonstrated interest, financing, and or commitments from key stakeholders, influencers, and partners for scaling up and sustaining the innovation. With this in mind, transition to scale applications should include monitoring and evaluation plans to ensure they can measure the effects of their innovation, monitor outcomes, and report on progress, as well as identify limitations. Okay, moving on to the ecosystem catalyst funding opportunity. Now, each priority country is faced with unique barriers that hinder sustainable implementation of innovations, constrain the broader integration of mental health and well-being, and limit local demand for youth mental health and well-being prevention and promotion initiatives. Thus, the collective goal for ecosystem catalyst projects is to build the country's enabling ecosystem for prevention and promotion initiatives and related innovations for youth mental health and well-being. To strengthen country ecosystems for youth mental health, efforts are needed to address the broader systemic barriers that hinder sustainable implementation, promote broader integration of mental health and well-being into adjacent areas, and begin to build local demand for youth mental health and well-being products and services. Funding between 200,000 and 300,000 Canadian is available for up to 24 months for ecosystem catalyst funding. Target users will involve a range of national and or subnational stakeholders and may include national government decision makers and departments, global agencies supporting young people's mental health in priority countries, public sector representatives, advocacy organizations, community service organizations, public and private funders, key influencers, as well as community leaders. Projects must be implemented in at least one of the 12 priority countries. As well, projects must align with specific country-specific ecosystem areas of focus outlined in Appendix A of the RFP. Now, given the complex task of strengthening ecosystems, ecosystem catalyst project teams are expected to have a wide range of skills and expertise, including data analysis and knowledge translation, experience in influencing positive systemic change, supporting and or advocacy for scale-up of mental health and well-being solutions, engaging with innovators and or innovator networks, public and multi-sector engagement, and monitoring, evaluation, and learning. Each ecosystem catalyst project will work towards the collective goal, which, as I mentioned, is to build the priority countries enabling ecosystem for prevention and promotion initiatives and related innovations for youth mental health and well-being. Working towards this goal may include, but is not limited to, achieving the follow priority outcomes, such as written changes in mental health related to policies, procedures, and or regulations, numerical and qualitative measures of increased mobilization of local demand for the scale-up of effective innovations, improved coordination among key stakeholders working to secure mental health improvements, increased government budgetary allocation to mental health priorities, and increased private sector investment in mental health priorities. This is a summary of the funding opportunities available in the RFP. As a recap, you can see that the funding amounts and project durations differ among all three opportunities. Target users for proof of concept and transition to scale are the same, while ecosystem catalyst projects can target a range of national and subnational stakeholders. The geographic scope is the same for all, implementing in at least one priority country. And finally, innovations must align with country priorities as identified in Appendix A. Again, these will be different for each country. Now, to finish off the section, here are a few examples of what we will not fund. Projects that involve proof of concept innovations where the core intellectual property rights are owned by a third party. However, as listed on the slide, there are a few exceptions. We will also not fund projects that are implemented in non-priority countries. And finally, we will not fund projects that focus on aspects unrelated to prevention and promotion, such as those with a focus on mental health treatment and care. For instance, projects that focus on symptom reduction among young people, or projects that focus on capacity building of health professionals to deliver treatment and care. Okay, so let's move to the last part of the formal presentation, which is the application process. Start with eligibility. Eligibility criteria for applicants is as follows. The first is that applicant organizations must be legally incorporated and based in any country to be eligible. Based refers to being legally incorporated or the equivalent in the applicable country. As well, all applicant organizations must implement their project in at least one of 12 priority countries. And finally, applicant organizations must meet all other requirements as outlined in the request for proposals and frequently asked question documents. It should be noted that while the previous eligibility criteria are quite broad and many organizations will be eligible to apply, preference will be given to eligible organizations according to the following criteria, with the first being the most preferred. Preference will be given to youth-led organizations based in one of the 12 priority countries. Youth-led is defined as 50% or more of the individuals in key leadership positions who are youth, 35 years or younger. Next, in terms of preference, are organizations that are based in one of the 12 priority countries. The next preferred criteria is followed by organizations that are based in any low and middle income country that are collaborating with an organization in one of the 12 priority countries. And last but not least are all other eligible organizations. Now, all applications will be accepted on a rolling basis. Now, this means that there is no deadline for applications, as applications are continually accepted. All applications will be reviewed at specific intake periods which are identified in the frequently asked questions document. Now, this process continues until the total funding for each funding opportunity has been awarded. We expect to fund approximately 40 to 45 proof of concept projects, 30 to 40 transition to scale projects, and 20 to 24 ecosystem catalyst projects. The application process involves 2 stages. Stage 1 includes submitting a screening questionnaire and a short project summary. Stage 2 includes submitting a full application. Please note, though, that only those applicants that pass stage 1 will be invited to submit a full application. Now, the next 3 slides provide an overview of the application process and review timelines for each funding opportunity. All applications will involve a two-stage review process: screening, which is stage 1, and external peer review, which is stage 2. As I mentioned, only those applications that pass the eligibility innovation screen, or stage 1, will be invited to participate in the full application process, or stage 2, and will undergo external peer review. Evaluation criteria for both stages for each funding opportunity can be found in the RFP and will be useful for developing your application. Please note that the images presented in the next 3 slides are included in the RFP. Key highlights for the proof of concept application and review process are as follows. Proof of concept funding will take approximately 6 to 9 months to move through the application process from stage 1 application submission to project start. Stage 1 applications will be reviewed approximately 1 to 2 months after the application intake deadline, and unsuccessful applicants will be notified within this time frame. Successful applicants will be invited to submit a full application during stage 2 and will be given approximately 4 weeks to complete their stage 2 application. Moving on to key highlights for the transition to scale application and review process. Transition to scale funding applications will take approximately 9 to 12 months to move through the application process from stage 1 application submission to project start. Stage 1 applications will be reviewed approximately 1 to 2 months after the application intake deadline, and unsuccessful applicants will be notified within this time frame. Successful applicants will be invited to submit a full application at stage 2 and will be given approximately 4 to 6 weeks to complete their stage 2 application. Proposals that pass through the 2-stage process will be presented to the relevant body of Grand Challenges Canada for a final funding decision. And finally, key highlights from the Ecosystem Catalyst application and review process are as follows. Ecosystem Catalyst funding applications will take approximately 9 months to move through the application process from submission to project start. Stage 1 applications will be reviewed approximately 1 to 2 months after the application deadline, and unsuccessful applicants will be notified within this time frame. Successful applicants will be invited to submit a full application during stage 2 and will be given approximately 4 to 6 weeks to complete their stage 2 application. Again, proposals that pass through the 2-stage process will be presented to the relevant body of Grand Challenges Canada for a final funding decision. To apply for funding, applicants must use the online application provided, which is only accessible via the Grand Challenges Flux portal. Instructions are provided in the RFP. Please see Appendix D for detailed instructions. Please note, though, that it may take 2 to 3 days to process new registrants. So please be sure to register prior to when you'd like to submit your application. Applicant support is available throughout the application process. During stage 1, the following supports are available, such as, of course, the request for proposals document and the frequently asked questions document. Innovator resources are listed throughout the RFP and available on the GCC website. And of course, this webinar, which is being recorded and can be accessed at a later date. During stage 2, various supports are provided based on the funding opportunity. For instance, regional webinars for proof of concept innovators will be provided through Origin, which is Being's learning and support provider. For transition to scale and ecosystem catalyst applicants, GCC team members will provide feedback on submitted applications and will allow for revisions before sending applications to peer reviewers, who will ultimately evaluate and score applications. A few application tips are listed here to assist with application development. First of all, ensure various criteria from the RFP are considered. For instance, priority country areas of focus for each funding priority are considered and included in your application, as well as funding opportunity criteria, such as cross-cutting themes, as well as priority outcomes. Number 2, be aware of word limits. Only be highly descriptive when necessary to convey key messages. And of course, concise answers are best. Please use a narrative format and refrain from using bullet points. Please keep in mind that some questions have multiple components. Be sure to read questions carefully and address all parts of each question. And although applications will only be accepted in English and French, we recognize that some applicants are not fluent in either language. As a result, we will not penalize applicants for grammar or unconventional phrasing. We've listed a number of reference documents that will be useful as you develop your application. We've gone over a few of them already. We've also listed key sections within the request for proposals that may be helpful for you. Section 2, which is the program scope, as well as the various sections related to funding opportunities. And we've also listed the appendices that will be helpful for developing various aspects of your application. And finally, we've listed other resources which may be helpful with application development, particularly for completing the full application for stage 2, including innovator resources found on our website, as well as other resources found on the Gender Equality Portal. So that concludes our formal presentation. We'll now move into the question and answer period.
Thank you so much, Sarisha, and thank you everyone for all of your questions in the chat. So as you've seen, we have tried to answer a couple of questions directly in the chat, but now we will give Sarisha an opportunity to speak to some of these more common questions. So first, how were the priority countries chosen, and do you anticipate any additional countries being added?
Okay, great. Thanks, Erica, for that question. So the priority countries were chosen based on a few factors that were considered. As we had mentioned, Being is actually a collaborative initiative. So the country selection criteria was aligned with the priorities across partners. For example, some of the criteria included government preparedness for sustainable implementation and scaling of proven solutions, rapidly growing urban centers where a large proportion of young people reside, and young people's needs regarding mental health and well-being. These are just a few of the factors that we considered when choosing priority countries. And to answer the second part of the question, unfortunately, we will not be adding any additional countries to the RFP at this time.
Thank you, Sarisha. The other question that we've been getting is, can multi-country proposals be submitted?
Yes, multi-country proposals can be submitted. However, GCC encourages applicants to take the following guidance into consideration. So given the unique and context-specific thematic focus for each country that's outlined in Appendix A of the RFP, applicants submitting a multi-country application must provide a clear rationale for how the innovation or solution responds to the unique context of each implementation country. We should also note that multi-country proposals can only be submitted for one funding opportunity. So they can be submitted for either proof of concept or transition to scale, but not for both. The funding maximum remains the same per application. So for example, for proof of concept, a maximum of 250,000 Canadian is the amount of funding available, and it must be split between countries included in the proposal. As well, the timeline remains the same for multi-country proposals. So for example, for proof of concept, projects can only be 15, 18, or 24 months.
Thank you, Srisha. Another question is, can an organization apply for more than one type of funding at the same time?
So yes, an organization can apply for more than one type of funding at the same time, provided that the project lead is different for each application.
And then the next similar question is, can an organization submit multiple applications for one type of funding at the same time?
So an organization for one type of funding at the same time.
Multiple proof of concept.
So an organization cannot submit multiple applications for one type of funding at the same time.
Okay, and then moving on, there's some comments about how youth-led organizations and youth-led projects are being prioritized, are they just being prioritized on being youth-led, like the organization being youth-led, or does that prioritization extend to projects that are youth-led? So could you speak a little bit more to how this has been prioritized?
Yes, so the organizations are being prioritized. And of course, as we know, that the focus of this RFP, of course, is our young people aged 10 to 24. So we're assuming that all projects will be youth-led in some way. We're hoping for that. However, priority or preference will be given to organizations that are primarily youth-led. But of course, as I stated in one of the earlier slides, there are a number of preferences. And of course, youth-led is the main priority, but there are other preferred types of organizations as well.
Thank you. And we are getting a recurring question about the application deadline. So if you could speak a little bit more to how we've set up the deadlines and where applicants can find these resources.
Sure. So as I mentioned, we have a rolling application deadline, which means that you can submit your application at any time. The caveat to this is that we will actually review applications during certain periods. Now, for example, if you submit your application within the month of April, we will then ensure that we review that application in the following 2 months. All of these timelines can be found in the frequently asked questions document, which is found on the Being website. And this document will be updated regularly with new dates for these intake periods as we've labeled them. So our first intake period is April 8th to April 30th. And at which point we'll review all of these applications that have been submitted. However, we will have another intake period, but feel free, as I mentioned, to submit your application at any time, and your application will be reviewed at the next review period. I hope that answers the question.
Thank you, Melanie. Sorry, thank you, Srisha. We also have a question about whether consortia of 5 organizations can apply. And if so, how would this be rated if 1 or 2 organizations are international and others are local?
That's a great question. I would say that, of course, consortia can apply. We would encourage the lead organization to be one that is either youth-led or based in one of our 12 priority countries, or of course, in terms of preference, based in a low and middle income country that is then collaborating with organizations within one of our 12 priority countries. So please keep in mind the preferences that we've stated in terms of the eligibility criteria. But please note that consortia are welcome to apply, but please be mindful of who the lead applicant organization is. That's listed on the application.
Thank you. Can an NGO collaborate with an organization led by young people to submit a proposal? The NGO will support young people's organization in developing the intervention model and provide technical assistance.
So if I understand correctly, and Erica, please correct me if I'm wrong, can an NGO apply in collaboration with a youth-led organization? Is that correct?
Sorry, I'm trying to find this question. Can an NGO collaborate with an organization led by young people to submit the proposal? And I think if I understand it right, the NGO would be collaborating to support that youth-led organization to submit a proposal. But if this was your question, feel free to comment in the chat and we can perhaps get you an answer.
From my understanding, if an NGO is collaborating with a youth-led organization to develop and submit a proposal, I think that's totally fine. As long as the youth-led organization is the primary organization or lead applicant organization that is applying for the funding, and not the NGO. I think that's how I think we would prefer applications to come in. But if the organization is youth-led, I think, of course, that's, our preferred organization that we'd love to fund.
And is any additional documentation required at this stage?
So as I mentioned in the presentation, there are 2 stages to the application process. Stage 1 involves filling out a screening questionnaire and submitting a very short project summary. There's no additional documentation required at that time. Stage 2 involves submitting a full application. Now, depending on the funding opportunity that you're applying to, you may be required to submit additional documents at specific points in the review process. Now, of course, we'll be in touch with you and let you know when additional documentation is required. But in terms of submitting the stage 1 piece, as well as submitting the stage 2 full application, additional documents are not required. Sahil, I just want to confirm with you that that's correct. Great. Got the go-ahead from Sahil. Yes, that's correct.
Great, thank you. And we're also getting some questions about where can we find the application questions. I can just answer that one quickly. All of the application questions can be found on Grand Challenges Canada's grants management portal called Flux. And the link to this can be found in the FAQ document or in Appendix D of the RFP, as well as all of the instructions to apply. Another question, I'm based in a non-implementation country, but I'm implementing in one of the being implementation countries. Can I apply for this RFP? And yes, absolutely, you can. Our bigger restriction is on where you're implementing. So I think one of the examples was you're based in Costa Rica, but might be implementing in Ecuador or Colombia. That's absolutely fine. Considering the focus on prevention and promotion, how is impact recommended to be measured?
So there's one slide within the slide deck that focuses on priority health outcomes. Now, these priority health outcomes are fully dependent on the type of project that you're proposing. For proof of concept and transition to scale, we've listed a number of example priority health outcomes for youth mental health projects. And these can vary from increased well-being, increased connectedness, increased social capital, to reduced stigmatizing attitudes, increased mental health literacy. But all of these outcomes are dependent on the type of project that you're proposing, as well as should be aligned with the specific areas of focus as identified by country. All of the examples that we provided within the priority health outcomes section in the RFP are examples of prevention and promotion outcomes, priority health outcomes. But again, this is not a full and comprehensive list. You may develop or come across other priority health outcomes that you'd like to measure. Please ensure that you do so and identify these within your application and ensure that they align with the project that you're proposing.
Thank you. If my application was not selected, can I reapply in the next intake period?
So yes, you can definitely reapply in the next intake period. What we ask you to do, of course, is you'll receive that notification that your application has not been accepted. You may receive feedback as well. So if you do receive some feedback that's useful, please take that feedback into consideration when revising your proposal for the next round. And please feel free to reapply. I would like to highlight, though, that if you are submitting a project, please keep in mind that you cannot submit the same proposal or a revised version of the proposal until you receive a decision, a funding decision. So if you've received a funding decision that says that your proposal will not move to the next stage, you are then eligible to reapply. If you have not received a funding decision, please wait until you receive that decision before reapplying with a revised version of your proposal.
Thank you, Srisha. And could you please elaborate on what characteristics define bold ideas? Are we looking for ideas with a high degree of innovation, or is it something else entirely? Thank you.
We are looking for bold ideas with a high degree of innovation. However, innovation might mean different things to the different countries that we're working with. For instance, there may be an innovative project that has been developed in one part of the world that has not necessarily been tested in one of our 12 priority countries. That may be an innovation then for that priority country. As well, innovations may be developed but have not been adapted for certain other parts of the world and maybe for our 12 priority countries. So innovations can then be adapted, and we would consider that these ideas are bold and innovative for that particular context, especially if they've been adapted for the specific social, cultural, contextual elements that affect youth mental health. There are other, I guess, criteria or guidelines that can be considered under the general areas of focus within the application. So please have a look at that section for additional criteria that might help you to shape your innovative solutions.
Thank you. And is I think this question would relate to transition to scale, but is the one-to-one match funds mandatory for eligibility into the transition to scale program?
So let me just pull up my notes on that. So and this is all of this information is included in the frequently asked questions. For most transition to scale projects, innovators are required to secure one-to-one match funds, a minimum of one-to-one cash-based match to Grand Challenges Canada funds through strategic funders and partners. However, at its option, Grand Challenges Canada may require more than one-to-one match funds based on the stage of the innovation. Though it is preferred, innovators may not be required to secure a commitment of match funds at the application stage, and exceptions may be made on a case-by-case basis by Grand Challenges Canada at its option. So With all that being said, match funding for TTS is encouraged. However, there are situations or circumstances where grand challenges may change that requirement from one-to-one match funding to either more or less.
Thank you. And I'm seeing a question here. What is the structure of the proposal? Is there a template? I think we might have just touched on this, but feel free to share again.
So as I mentioned, there's a two-stage application process. The first stage of the application process involves completing an eligibility and screening questionnaire and submitting a short project summary. The full application as part of stage 2 includes submitting a full application, and the application questions in the form is available through our online portal, Flux. All of the details in terms of how to log in and create an account are found within the RFP. I will note, however, that when looking at the stage 2 full applications, evaluation criteria are listed within the RFP for each funding opportunity. Please have a look at the evaluation criteria within the RFP for stage 2 full applications. That will give you an idea of elements to include in your full application, as well as, how much emphasis might be placed on certain aspects within your application. So looking at the evaluation criteria is very important when you're developing your application, in addition to looking at the application form that's found on Flux.
Thank you. Sorry, I'm just trying to sift through these last questions here. For ecosystem catalyst funding, can you please clarify that it is not required to directly engage with youth, but rather the engagement can occur with stakeholders, various individuals and institutions from both public and private sectors? Is that correct?
That's 100% correct. So the target population includes national and subnational stakeholders for ecosystem catalyst building grants. Now, these ecosystem catalyst funding opportunities are looking to build the ecosystem, which is why we're looking at targeting different users as opposed to proof of concept and transition to scale. However, the ultimate goal of these ecosystem catalysts grants are to strengthen the mental health ecosystem within our priority countries for youth mental health and well-being. So indirectly, we will be, of course, targeting youth in some respects, but our primary target users for ecosystem catalyst grants are national and subnational level stakeholders, including private organizations, national partners. I listed quite a few within the presentation as well, and these are also listed within the RFP.
Thank you so much, Sarisha. I think we're going to move to wrap up the Q&A shortly. I'm still seeing a lot of questions in the chat, and I would urge everyone to review the various sections of the RFP, which we've outlined throughout this presentation for further clarity into, I'm seeing a lot of questions about, I have this type of organization, am I eligible for funding? So all of that information does live within the RFP and in the frequently asked questions document. And if we have not answered your question here today, as Sarisha has mentioned, please feel free to submit a question to the our shared inbox, info@being-initiative.org. And I do believe we will be making this presentation available on our website for your reference going forward. Is there anything else, Teresa, that you'd like to add before we wrap up?
No, thanks, Erica, and thanks to the GCC team for all of your support, and to Melanie, Sahil, Suad for hosting the chat and answering questions throughout the presentation. And of course, as Melanie shared with everyone, the presentation and the recording will be available shortly. Thank you to all for joining, and we look forward to seeing your applications. Take care, and please keep in touch via our group email, as Erica mentioned. Have a wonderful day. Thanks.